Hello, everybody. My name is Dr. Olivia Chalak Clevo, your self-appointed weight loss specialist for 2026. It's been a while, but I'm happy to be back. Today, we are going to talk about stress and how it affects weight loss. In my previous video, I gave an explanation of how cortisol sabotages your weight loss attempts. So now we are going to have a deep dive into stress generally and then see how it affects your weight loss. So first of all, what is stress? Stress is your body's natural response to any threat or challenge. So for example, you go to a friend's house and there's a big wild dog there. Your body will activate a stress response. So your body is going to be deciding whether to fight the dog or to run away. So we call it a fight flight response. Either you're going to be fighting the dog or you're going to be running away from the dog. So in that moment, your body will release certain hormones, adrenaline, cortisol, and all to sharpen your senses and to release a lot of energy for whatever it is you're going to do. So I don't know if you've noticed, but maybe if something just happens, you will notice that you can really run fast or jump something you naturally couldn't have. That response enables you to do something very great. So that stress response is good. It's good and it is defensive. It helps you to survive. However, if you have that stress response turned on for a long period of time, then it becomes detrimental to your health. So what are the different types of stress? We are going to classify the different types of stress according to time. So when you have a stress that lasts for a very short time, we call it acute stress. So for example, in 2 or 3 days time, you have an exam. You will see that you are stressed, you are able to study longer. That's an acute stress. You have a presentation, you have an exam, your body will go into some form of stress to be able to meet that deadline and to be able to accomplish whatever it is that is ahead of you. And that's all right. And one of the features of acute stress is that as soon as the event or whatever it is ends, the stress goes away, and that's totally fine. Then we have episodic acute stress. So there are some people that for some reason they're having acute stress a little more frequently than we're expecting. So this week you have an exam, next week you have a presentation, the following week you have an interview, on the 4th week your cat died, on the 5th week you lost your dog. So it's episodic, it's acute stress, but it's happening in short intervals. Then we also have chronic stress, which is the dangerous one, which a lot of people actually experience. That's being in a state of stress for a long time, for months, years. And you will find this in people who have high pressure demand jobs or stressful jobs, or you find people in unhappy, toxic relationships, or you find it in people going through financial stresses, or you find it in people who are dealing with the chronic illness, like somebody who is undergoing cancer treatment. That's chronic stress, and that one is very dangerous and very detrimental to your health. So after defining the stresses, now we're going to look at symptoms. What are some of the things that you see that should be pointing you in a certain direction? Kindly note that this video is not giving you a medical diagnosis, it's medical advice. So you need to look at it in the context. So what are some of the symptoms of stress? Physically, you may be having headaches, muscle tensions. You see that some people have headaches, neck pains, shoulder pains all the time. They're even taking paracetamol for it. It's not working. If you have headache, this is just a side note, you need a diagnosis for the headache because it can even be a tumor. So getting back to where we started from, headache, you see people may even have digestive issues, vomiting, indigestion, diarrhea, constipation, these are the digestive. Then some people may begin to have palpitations, their heart is beating fast all the time. Sometimes they may even have chest pain. It's also one of the physical symptoms of stress. Then you can have tiredness. There are some people that they can have the whole day do nothing, or they can have long hours of sleep, or they even always have good sleep. Like they have at least 8 hours of sleep, which is like recommended, but still they are always tired. Relatively, you can have symptoms like forgetfulness, racing thoughts, poor concentration, brain fog. All these are symptoms of stress. Mentally, you can have anxiety, depression, you can have even being irritable, like something just little happens and then you snap, like all hell has broken loose because of something very little. When you begin to see some of these things, you need to begin to pay attention and ask a few questions. Okay, so in this video we have spoken about the definition of stress, types of stress, and some of the symptoms of stress. There are many more symptoms of stress, and I'll encourage you to read a little more around this and see which constellation of symptoms you're beginning to have. And then in my next video, we are going to be talking about how to manage it and how to even identify the kind of things that are stressing you out. See you in my next video. It's been nice catching up with you. See you.